time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, so let me ask you a question. Have any one of you or you know anyone who ever had suicidal thoughts, violent behavior, alcohol and drug dependence, delusional and psychotic behavior, or severe anxiety and depression? If you had any one of those, or if you know of anyone, this show will be a great informational show for you. I'm so happy to have on my show today from the Community Counseling Services, Kelly Petrick, who is the Executive Director. We have Beth Hollinger, who is the Supervisor for Community Counseling Services, and of course, my good friend, the Honorable Judge Bill Amesbury from Luzerne County Court. This is a show, folks, very, very informational and something I'm hoping could help a lot of you. We're going to put a phone number up there at any time. In fact, Andy, you could always throw that phone number out throughout the show. Call it. It's 1-800-600-NEPA or 1-800-600-6372. Judge, always nice to see you.
Sam, it's always my pleasure. Good morning. It's always wonderful to be back in Hazleton.
Well, you know, I have to say this. I say this all the time. You know, when we have people come on the show, particularly judges or the governor or any politician, you know, before they run, you're always, you know, et cetera. And then after they run, you know, the governor always comes back on. But Bill, you've always been so involved in so many great things in the county. You know, you're a great asset to the county as a judge. You gain a great reputation, and I hate to tell you all these things because I don't want your head to get big. But you are truly a great person, and you do a fabulous job. And just like I asked you today, why are you here today with the community service, with the constables, etc.? And what was your answer?
Well, Sam, these things are important, okay? This is community. This is who we are. This is what we are. And it's the betterment of that community that's going to improve life for everyone. You know, what we have today is something I myself was a part of. We're talking about crisis intervention. We're talking about situations that happen on a daily basis. And some 40 years ago, before I earned my law degree, I had a master's degree in social work. I worked crisis intervention from 4 to midnight, midnight to 8. Did it for a number of years. So I understand what these young ladies are going through, and I've had the opportunity to be there hands-on. And I think this is just a tremendous collaborative effort where right now we have private coming to the aid and assistance of government. It's truly unique and it's outstanding.
This is the Crisis Response and Recovery Center we're talking about, folks, okay? How does this work? How does this work hand in hand, okay? Which is great because you're bringing private and government together, okay? How does this work for you as far as in the courthouse?
A number of ways. First of all and foremost, it gives us an opportunity to intervene within situations that do not then require incarceration as the means by which we call it out. And that is extremely important in a time in Luzerne County's history where our prisons are at full capacity. It's not only at the county level, it's at the state level, it's at the federal level as well. An opportunity to intervene, to redirect it without the need for incarceration, without the need for taxpayer dollars. It's a wonderful collaboration, and I'd be remiss if I didn't say these people know far more about it than I do, and I'd much rather they tell you about it.
Well, what I like to do is show the connection here, sure, okay, as to why, okay? So Kelly Petrick, am I saying it correctly this time?
Yes, you are.
All right. Kelly, tell us about the Community Counseling Services for those people just, you know, wanting to know what it's about. Because I mentioned some things in the beginning, you know, suicidal thoughts, violent behavior, et cetera, et cetera. But first, what do you do? What is that your center all about?
Community Counseling Services is a community-based mental health program that services individuals in Luzerne and Wyoming counties and beyond that to help them deal with emotional and behavioral disturbances, chemical dependency issues. We offer a variety of programs at Community Counseling Services, including individual therapy, medication management, group therapy, vocational rehabilitation programs, case management services, crisis services. We have also a variety of housing options, including residential and personal care home options available as well.
So who would need you?
Across the world, there is statistics that says 1 in 4 people suffer from mental illness at some point in their lives. A lot of people say that 4 in 4 people are then affected by mental illness. Individuals who are suffering from depression, anxiety, more severe emotional disorders such as schizophrenia, and we treat everyone. So all of those individuals receive treatment, but we also treat people who have change of life problems, who might be slightly depressed because of losing a job, a divorce, loss of a loved one. So our services are all encompassing as far as the mental health aspect goes.
The biggest problem you have, that I think you have, is that people, to admit the fact that they have the problem, either embarrassed, I'm not going to that, they're going to think I'm nuts, I'm not, and it's that breaking. It's like going on a diet. It's like quitting something that's bad. And so what advice do you have? And it's tough. I mean, you may have a spouse, you may have a sibling, you may have a relative that or you yourself. Right. What do I do to make it easier for me to admit that I got a problem?
I think that without a doubt, probably one of the biggest struggles we see in consumers coming into treatment, family members bringing their loved ones in for treatment, is facing the stigma of what mental health means, what being diagnosed with a mental illness means for them. We do our best to minimize and alleviate that as best we can. I think that when you look back 5 years ago, 10 years ago, 20 years ago, certainly there have been drastic improvements in how mental health is viewed by the community, certainly as politicians, people with some fame attached to their name come out and take ownership of their own mental health issues, and it makes it more real for everyone and realize that it affects everyone and it can affect anyone at any time at any point in their lives. It's certainly helpful. When individuals personally to me have said I'm concerned about what it means to be considered mentally ill, I tend to push them towards the thought of it's not unlike having diabetes. If you had a medical issue and you didn't take care of it, you're going to become more sick, and it's going to have it's devastating impacts across your life in different areas. Mental illness is no different than having diabetes or any other medical problem. If treated appropriately, recovery is there and you're able to move on with your life in a normal fashion for most individuals. But ignoring it will, again, have devastating consequences across. So it's important to address it before it becomes a bigger issue than it is today.
Sam, just to digress for a moment, you may recall a while ago we were here before you when we were talking about the CIT program, which is another example of the collaboration that takes place.
Explain what CIT is.
Yeah, well, Kelly's going to tell you because she's the one who provides the training.
Okay, all right.
And what happens here, and by collaboration I mean, we have police officers from the various police departments here in Luzerne County who actually undergo a very extensive training to help them identify the manifestations of well-defined emotional disorders, as well as the problems that we have with drug and alcohol. And Kelly, please, it's your floor. And brother, you carry the ball.
He is.
He's my co-host.
And I was going to wrap all of this in for him.
He wanted the Bill and Sam show.
I know he did. He does. He's getting there. As far as the stigma with mental health goes, one of the reasons, and we're getting to talking about the crisis residential unit, one of our goals in creating the crisis residential unit was to give consumers a safe alternative to where they typically seek out crisis services, and that's in emergency rooms across the state and across the country. That's the typical area where they go. The crisis residential unit, or the crisis response and recovery unit, was designed with that exact thought in mind, is to reduce the stigma so that the individual does not have to go into an emergency room, be registered along with medical patients in an environment that is generally not friendly to consumers who are at that moment are suffering from a mental health emergency. The lighting is lower, it's softer volumes, furniture is different, it doesn't look like a hospital setting. And so that was our goal in creating it, to help reduce that stigma. And every aspect of the design, from what we put on the floors to what we put on the walls to how the staff are trained, it was all done with that in mind, to reduce the stigma. And part of that was rolling into the crisis intervention training, as the CIT, the crisis intervention training. Actually, next week will be our second training in Luzerne County, where we will host this class. We have 22 officers from across Luzerne and Wyoming County who will be coming in to receive specialized training in the emotional disorders, as Judge Amesbury said. part of that training now, thanks to the Crisis Response and Recovery Center, we'll be able to give the officers an alternative place to take individuals who they come in contact in the community, so they're not going to prison, so they're not going to emergency room settings, in hopes that we'll be able to further reduce unnecessary imprisonment, unnecessary inpatient care for those individuals with mental illness in the community who come in contact with police.
Folks, if you just tuned in, you're watching the Sam Lesante Show, and remember 24/7, you can watch us on my show today. The Honorable Judge Bill Amesbury from Luzerne County Court, Kelly Petrick, who is the Executive Director for Counseling, Community Counseling Services, and I didn't forget you, Beth Hollinger, who is the Supervisor. We come back, some of the telltale signs. Remember, folks, this is something to help you. It's a difficult task, I understand that, but when I come back, I want to find out some of the things that we should be looking for. Also, what have been some of the results? You know, the time that you know you need it, but you're afraid to do it, and you just feel that something's not right. Once you do it, then you feel very good about it. Stay with us. We'll be back right after the break. Welcome back to the Sam Lesante Show, folks. Remember, the official water of Samson Productions SSP TV is GreatSpringWater.com. It says here it's like good but better. This is the official water, folks. When you get it, go to their website, GreatSpringWater.com, and you'll understand why it is the official water of Samson Productions and also SSP TV. Remember, folks, 24/7, you can watch all of our shows. Thank you so much, folks, for making News 13. Get a load of this, folks. According to our last survey, News 13, over 70,000 people watching our news Monday through Friday, which is amazing. Hyperlocal is just growing through the roof. I thank you so much. And for the Sam Lesante Show, now up to 175,000 people per week. The girls, 125,000 people per week. I just want to thank you so much as the CEO of this company. I appreciate it very much. My guest today, folks, the Honorable Bill Amesbury from Luzerne County Court, and we have Kelly Petrick, who is the Executive Director for the Community Counseling Services, and Beth Hollinger, who is a Supervisor. And Beth, you thought I forgot all about you, didn't you?
I did.
Okay, because Bill was taking over the show. No, Bill, okay, we're talking about the Crisis Response and Recovery Center, and like we talked about, if you have suicidal thoughts, violent behavior, alcohol and drug dependence, delusional and psychotic behavior, severe anxiety, depression, when you think about, I have all of these sometimes, but what are some of the telltale signs, and then how do I get that person to make that phone call to 1-855-600-NEP PA? What do we do?
I think the first thing that we need to do for everybody, whether it's for yourself or for anybody else, is the acknowledgement that mental illness exists. It's going to impact 1 in 4 people. It's going to impact their families. Treatment. Getting involved, being engaged, being educated is the sure path to recovery. And if it's you, make the call today. Make it now. If it's somebody that you love, we're best off not ignoring it. We're best off not hoping it's going to get better. We're best off directly talking to the person and telling them what we see. I see you isolating. I see you not sleeping. You're not eating. What's going on? Let folks know that we see that something's going on, that something's different. The more we talk about it, the more we suggest that they get involved in treatment. That's how they're going to get involved in treatment. And we want to do that before it becomes a crisis, before it becomes an emergency and somebody's a danger to themselves or someone else.
Okay, so now I want you to help me out here, okay? I know there's someone in the family, or I know of someone who has a problem. I just don't know how to approach them. Can I call 1-855-600-NEPA to get some advice how to approach that person?
Absolutely. That's what our crisis clinicians are trained to do. We're certainly trained to interact with and evaluate someone who comes in for crisis treatment, but we're also trained to talk to families about engaging people in services and how do we do that. But again, my honesty, straightforward, this is what I see. is the best way to go in any situation.
And every phone call and every person is private. Okay, I don't have to worry about, neighbors know that I'm flipping that I'm going to, because listen, it's like anything else. If you're sick, you want to get, go to the doctor, etc. And this could be devastating. So the interesting thing is, as far as payment, folks, they have insurances. They take most insurances. Well, you tell me, who you take?
We take every insurance, and it's important to keep in mind that crisis services are provided by the county regardless of insurance. Payment is should never be a concern for any individual seeking out mental health treatment in the community. Crisis services are almost an innate right as a resident living in the county, so there should be never any concern for that. Seeking out services at the Crisis Response and Recovery Center should be easy and flow naturally, and that's the way we've designed it. As far as the insurances go, if you don't have insurance, we help individuals apply for insurance, get insurance, and if not, there is always county funding available.
Without names being mentioned, give me some examples of some case studies of that you could, or maybe that maybe could relate to some of our viewers. Okay, a story of a case study and what the results were. I'm sure you got thousands of them, but just give me one that so people could relate that there is help at the, as Bill says, there's a light at the end of the tunnel.
Okay.
Whatever that means, I don't know.
I can give you an example of a young gentleman who, this is going back a number of years, his mother had become, he was living at home with his mother. Mother had become seriously ill. We end up, someone from a neighbor reached out to us and said, we need help here. We did a crisis outreach to this person a couple of times, engaged them on more than one occasion. Connected him with case management services, which is a supportive service in the community-based. No. His mother was hospitalized medically, and he was living in the home by himself and was having some difficulties because he had been very dependent upon his mom for services. Through the engagement, we were able to get him into services with us. He's currently living in a personal care facility. But the good news is he's now thinking and talking about the steps that he needs to take to get his own place, to live independently. He talks about getting a job now, which were all things that he never thought he'd be able to do because of his depression, obsessive compulsive disorder, and the issues that he had dealt with. And unfortunately, his mom thought she was doing the best for him in terms of just providing for his needs. But by never addressing the issues head on, it kind of unfortunately held him back.
As I look at some of these things here, they're all important. Suicidal thoughts, violent behavior, delusional and psychotic behavior, severe anxiety, depression. But the two areas here that I think, Judge, you see a lot, or the courthouse sees, is either alcohol and drugs. Okay?
Absolutely. And
this is an area, folks, that you really, alcohol and drugs has been the biggest problem we have, primarily in drugs. This is an opportunity for people who they feel have an out here. I'm not an out, but help.
Yeah, Sam, first of all, look at our most recent statistics indicate over 80% of the people who are coming into the correctional facility with criminal charges, a component of that situation is drug and/or alcohol, as well as what's referred to in the literature as co-occurring disorders. What that means is these people have a well-defined emotional disorder, whether it is a bipolar, a depression, anxiety, a personality disorder, but they don't present that way. What they present with, or the first level, is the drug and alcohol. And until you take the drug and alcohol out of the system, clinically speaking, you don't know what you'll find. And of course, since our prisons are continuously refilling, it tells you the extent of the problem that we face.
Folks, I know sometimes you're hesitant, but this, as I said when I opened the show, it's a show that informs you. It's 1-855-600-NEPA. We come back, we'll talk a little bit more about this crisis center, which I think is critical for you to respond to. You have an out here. You have an opportunity of help. So stay with us. Thanks for staying with us, folks. I'm Sam Lesante, SSPTV.com, 24/7. Sam@SSPTV.com is my email. My guest today is Kelly Petrick, who is Executive Director of Community Counseling Services, Beth Hollinger, who is the Supervisor, and the Honorable Bill Amesbury from the Luzerne County Court. Beth, there are two parts of the Crisis Response and Recovery Center. Explain them to us.
The response side is the crisis side. That's where folks who call the number that you gave, they'll reach crisis clinicians there. We're located, the center itself is located in the old emergency room at Wilkes-Barre General Hospital. Folks can walk into that center 24 hours a day, speak with a crisis clinician, and in the near future have 24-hour access via telepsychiatry to a psychiatric evaluation. That's key to getting people out of our emergency rooms, and that's not the appropriate place for folks seeking psychiatric care. So that's why the center was built. The other side of it is the recovery center, which is an 8-bed crisis residential unit. Folks can come in for a maximum of 5 days. While they're there, they get a psychiatric assessment. We involve case management. We involve family. It's all about education, building support, developing a crisis plan. So when folks go out, they have the tools that they need to continue their recovery journey. We make sure they're connected to a good, solid treatment source in the community. We make sure their family, their supports know what to do moving forward. If they need drug and alcohol treatment, we make those connections. We've had Victims Resource Center come in and talk to residents of the center who have had traumas in their lives. We can take folks out to appointments if they have a hearing to get to, if they have a doctor's appointment to get to. We can make sure that their life isn't interrupted while they're getting the tools and support that they need during a stay at the crisis residential unit.
A lot going on, isn't there?
It's absolutely. Yeah. It's 5 days may seem like a short amount of time, but we can get an awful lot done.
The good thing is that we have the facilities like this available to help people and for them to take advantage of it, okay? And like I said, you know, there are people out there that really should have this help, but are afraid sometimes to make the call because they'll be put into a category, which is not the case. I mean, here again, I can't emphasize enough that if you need that help, it's available to you. Correct, Judge?
Absolutely. And the point being, we need to advertise these services as you're doing today by virtue of your show. We need to find mechanisms by which we can notify the public as to what's available to them so they can take advantage of these services. And once again, from me to you, thank you for the continuous opportunities you have given to us to try to reach out to the people of Luzerne County, Schuylkill, Carbon, to let them know what's going on here in terms of treatment.
Well, it's certainly appreciated, but that's the whole purpose. I've seen a lot of these shows that, you know, if we save one person's life is very important. And I had mentioned to you, Kelly, you know, all the people are skilled. Believe me, I could never do this. I mean, it's a special talent, you know, you have to have, and you certainly have that. It's 1-855-600 NEPA, folks. Once again, if you have any of these particular things, just a phone call. Maybe a phone call, make a phone call, say I'm experiencing this or whatever. They'll give you guidance. It's a good process. It's great. If Judge Amesbury is supporting this, you know it is 100% right on target. And we're here to help you. Kelly, once again, thank you. Beth,
you.
And the good judge, thanks for coming on the
Sam,
show.
always a pleasure.
I appreciate it. Now, you know, folks, this show is available anytime, 24/7. Just go to our website, ssptv.com, hit shows, Sam Lesante Show. All my shows are there. But you may have friends anywhere in the country that may want to listen to the show. I'm sure in those areas they have similar things. If not, at least we could give you some type of help. Thanks for joining us. We'll see you next time.